And welcome back. It's Wellness Wednesday. It's a special segment designed to help us all live a little healthier.
The Metro nonprofit Oklahoma Project Women is teaming up with OU Health to provide free mammogram screening.
It's pretty incredible. News 9's Jordan Daphnis joins us live with more of those details. Jordan?
Well, you guys, this is something that they do all year round because all year round, you need to get mammograms. You need to get screened to make sure that your body is healthy. And to explain more, I've got Dr. Betsy Jett here. Betsy, can you tell us a little bit about why mammograms are so important?
So mammography is the only technology we have that has been proven to reduce your risk of dying from breast cancer. And so our goal is to improve survival and to catch cancer as early as we can to allow you to have less aggressive treatment.
And what is OU Health doing to make sure that women who may not have the funding to come in here and get a test, how do you make sure that they have access?
So we have a number of programs that are available. We work with an amazing nonprofit called Oklahoma Project Women that will provide screening and diagnostic, and if you need it and don't qualify for any other program, all the way up through surgery for treatment for breast cancer. We also have a grant from the National Breast Cancer Foundation that will pay for screening and diagnostic mammography and ultrasound for women who qualify, which is basically you're uninsured and you meet the income guidelines.
Wow, I know some women may hear that and they may be like, okay, well, how can I find that? Like, how can I access that information? Do you have any idea where they can go to learn about the opportunities afforded to them?
So Oklahoma Project Woman has a number of clinics that you can access. If you will call our clinic, we will plug you in with the resource that is best suited for your income level, what you qualify for, and what you need, and then we can point you in the right direction.
Awesome. And Betsy, what difference can getting a mammogram make versus, you know, maybe waiting and putting it off a little bit, as I know we all can do?
It saves your life. I mean, that's the easy answer, right? If we find it early before it has spread anywhere else, women don't die of breast cancer that's confined to the breast. They die when it spreads somewhere else. So truly, it can save your life. But it also allows for less aggressive therapy. If you can avoid chemotherapy and more aggressive surgery, that's a great thing. It allows you to get on with your life. You have fewer side effects from the treatment itself.
Awesome. And what about the men out there? I know that this impacts like mainly women, but there's also some guys that are impacted by breast cancer as well.
So we typically don't screen men unless they have a genetic mutation. But certainly men can get breast cancer. About 1% of breast cancer in the United States is diagnosed in men. And if they feel a lump or they notice something going on, they should absolutely come in. And it's the same workup. We'll do a mammogram and an ultrasound and find out what's going on.
Awesome information. Okay, what is the age that a woman should come in and maybe start getting a regular mammogram screening?
So we recommend that women, when they turn 40, start getting a mammogram every year. And women who are at high risk may need to start sooner. So the current guideline from the American College of Radiology and the Society of Breast Imaging is that every woman before the age of 30 should undergo a risk assessment with their doctor so that if you qualify for high-risk screening, we start that at an early age.
Dr. Betsy Jett, thank you so much
for
your time. This has been such great information that I know we all can use. This reminder, we know it's important, but you got to get in here and get it done. Take the time, ladies. This is for you. Live this morning, Jordan Daphnis, Oklahoma's Own, News 9.